Dr. Sharfstein, almost every parent out there is going to get a dreaded email one morning in the next couple of weeks saying somebody in your kid's school was diagnosed with COVID. Don't worry or worry. You have to quarantine or not quarantine. What is the correct protocol if someone is in contact or within 6 feet for, say, 10 straight minutes, even if they are masked in a school?
What I would say is it's really important for there to be good communication about this and to explain to parents as much as possible exactly how this will be handled and then follow through on that rather than surprise everyone the first time there's a positive test. It is going to be expected that may happen. Here's how we're going to deal with it. And I think that in general, it is certainly for kids who are vaccinated, older kids who are vaccinated, they do not necessarily, according to the CDC, I think, need to be quarantined. Some schools may want to do that out of an abundance of caution. Others may want to try to use tests, for example, to keep kids in school. There are going to be a few different practices. I think the most important thing is that they're explained clearly to parents and that the school is monitoring whether their particular approach works and is flexible to changing if necessary, based on what they see early in the school year.
Dr. Sharfstein, the start of the New York City school year really highlights how people are trying to get back to some semblance of normal. People are saying get back to the office. City workers have to be back in person. And yet it is pockmarked by all these notices and by the ongoing spread of the virus. When do we get to some sort of equilibrium? Or are we heading into a really perilous fall where people are trying to act like everything is normal when it is anything but?
I think that we're headed right now into a bit of a new normal. You know, we can go to work, but we may need to wear masks in the workplace or make sure everybody's vaccinated. And that people need to be a little bit more vigilant. I think we're going to be in that period for a while, at least until cases really go down. And we, get a little bit more of a distance between us and the virus. It obviously depends on where you are in the country and the situation. But for example, at our school, we have kids back in class. We have a little bit more distance than usual, fewer people in a classroom, but they can sit, 3 feet away with a mask on, and everybody is vaccinated. So, we have a new normal, but we are excited to be in the classroom and teaching, and I've been doing some of that.